everyone, my name is Larissa and today I'm going to talk about tremor. What it is, what causes it in Charcot-Marie-Tooth disease or CMT, and what we can do to make it better. Let's go! Tremor, especially hand tremor, is a very annoying symptom that approximately half of the people with CMT have to deal with, including me, irrespective of CMT type. Some people might say, well, I have tremor, but I don't have CMT, which might be true, but the rate of tremor is way higher in people with CMT than in healthy people. Approximately 50% in people with CMT, but only 1 to 5% among general population. So I'm sure many of you with CMT can relate to these rhythmic, involuntarily movements in your hands, which make us poor waiters. Good luck carrying that tray without spilling any drinks, and surgeons. Thank God I decided not to become a dentist, which I wanted to do when I was a kid. And I'm sure I couldn't perform knee surgeries during my PhD because of my tremor. I had to operate on mice and I had to drill their skulls, ideally without rupturing any blood vessels underneath, but I could never master it. And I do blame my hand tremor for that. But what is the mechanism behind hand tremor in CMT? Because if we do understand the mechanism, maybe we can come up with ways to solve it, to get rid of tremor. Well, let me disappoint you at the very beginning by saying that the mechanism of tremors is really poorly understood in healthy people and in people with neurologic diseases, including CMT. Certain regions of the brain, the cerebellum and the brainstem, are thought to be associated with tremor generation, but it's really not clear what causes tremors in all kinds of conditions and in healthy people. In CMT, it's tempting to say, well, it's probably because of the peripheral nervous system, not the central nervous system, because CMT causes the degradation of neurons, the degradation of myelination of neurons, and probably that's why we have tremors. But this is, first of all, not really an explanation, and second of all, it might not be true. Maybe there is an involvement of the central nervous system in CMT, which causes tremor as well. Well, researchers from the UK decided to address this question, and they performed a study, which they published back in 2015, on 23 people with CMT, 13 with tremor and 10 without. The participants mostly had CMT1A, but there were also some with 1B and 2A. They were tasked with a spiral drawing test. The examples of the drawings by these patients with tremor you can see here. And out of curiosity, I decided to find this test and do it by myself. I didn't detect any disturbances in my line, but you can also do it if you're interested. You can follow the link in the description below to download the test itself. So after conducting a series of other tests, the researchers concluded that basically the tremor in CMT patients that they looked at is not caused by cerebellar dysfunction. So the brain region, which I already mentioned, the cerebellum, it's located right here and it is responsible for movement coordination. It seems like it is not involved in tremor generation in people with CMT. So the researchers make a conclusion that the tremor in CMT patients is due to the enhancement of the central component of the physiological tremor. What the hell does that mean? That sounds very complicated. Well, physiological tremor just means normal tremor. Just like I mentioned at the beginning of this video, some people, healthy people, experience tremor, and it's called physiological tremor, normal tremor. So in people with CMT, it might be that this physiological tremor is enhanced. So in healthy people, it might be happening due to some activity in the central nervous system in the brain, and so this activity might be enhanced in people with CMT. This is the conclusion that these researchers of this study made. They are also speculating that maybe the tremor in CMT patients might be either made worse or caused by fatigue. And it is true that people with CMT experience fatigue, And if you, let's say, exercise, if you walk more, your muscles get fatigued and you might experience tremor because of the fatigue of the muscles. This seems like a legitimate hypothesis, but really this study still doesn't answer the question, what is the mechanism of tremor in CMT patients? A couple more words about this study before I move on to the other one. In this study, they found that there was no correlation between tremor severity and age. So the answer to the question, will my tremor get worse as I age, as my CMT progresses, might be no, actually, surprisingly. And also in the study, they showed that the nerve conduction velocity, the result that you get after you have your EMG done, also doesn't correlate with tremor severity. So it's really difficult to say. It's not like the worse your CMT is, the worse your tremor is going to get. This is not the case. So then another study, a more recent study of 2023, was conducted in Australia. And in this study, 17 people with CMT participated. They all had CMT1A. In these participants, what was found out is that 65% of these participants, of people with CMT1A, experienced tremor in their upper limbs, so meaning arms, hands. And most of this tremor is mild, although 18% of the patients did experience moderate to severe tremor, which was intruding into the rest. So during rest, these people also experienced tremor. So I don't know about you, but I feel like I don't have resting tremor. I only have tremor associated with movement, especially if I try to focus. So as I mentioned at the beginning of this video, when I tried drilling the skull of the mice, it was very difficult because once I start focusing, I try to keep my hand steady, but it gives the opposite effect. My hands start trembling, start shaking more. But back to the study. In this study, it was also shown that 35% of people with CMT1A experience lower limb tremor, so with their legs outstretched, which I don't have, but I do have, I think, fatigue-induced tremor of the muscles. So for example, if I exercise, especially if I stretch, sometimes my legs start tremoring. This is a different type of tremor. So there is postural and kinetic type of tremor. People with CMT seem to experience both kinetic and postural in both types of limbs, in upper limbs and in lower limbs. So this study basically confirmed that this is the case. Now, as for the mechanism of the tremor, what did the study of 2023 show? Basically, the researchers showed that we have an impaired input from our peripheral nerves, right? This makes sense. And it kind of confuses our brain. That's why the brain causes our hands or our legs to shake, to generate tremor. So this is currently the hypothesis. It is really rooted into the fact that our peripheral nervous system is not performing very well due to either demyelination or axonal degeneration or both. And these weird inputs confuses the central nervous system, therefore it kind of makes us produce tremor. And so the researchers make a conclusion that yes, definitely there is the involvement of this peripheral nervous system, but there is a central component of the CMT associated tremor. So this central component, where is it exactly in the brain? And the researchers speculate that it's probably in the thalamic nucleus, in a specific region of the thalamic nucleus, which you can see on this picture. Why do they think that? Because previous studies, in fact there were two, that showed that deep brain stimulation of this particular region of the brain leads to decrease of tremor in people with CMT. So the two studies that they refer to is one was conducted in 2017 and it enrolled only 2 patients with CMT axonal type, so type 2. We don't know which letter, so we don't know which mutations caused the CMT, but they did receive deep brain stimulation, which is an invasive procedure. It requires a surgery during which an electrode is inserted in the brain, and it's quite deep, right? Deep brain stimulation, because the thalamic nucleus is deep in the brain. Unfortunately, I don't have access to the full paper, so I can't really read this study. The other one, it was conducted in 2009, and it was also about exploring the effect of deep brain stimulation on tremor for a person with CMT, but this time demyelinating type. And again, we don't know what type it is. In this paper, it's not even called CMT. It's called rus syndrome, which is a whole different story. I can touch upon that in a separate video. But anyway, the tremor was reduced by 30% in this study for this one patient. It was only one patient, a lady, if I remember correctly, in her 60s. So although we have very limited data like that on deep brain stimulation for tremor reduction in CMT patients, it kind of supports the hypothesis that there is a central component of the tremor in CMT patients. And if we stimulate the brain, a specific part of the brain, we might reduce tremor. So now that I'm transitioning into the treatment options for tremor in people with CMT, it is important to say that deep brain stimulation is a treatment option, but because it is very invasive, it involves a surgery, it is not recommended for mild tremor. So I would definitely not consider deep brain stimulation because the risks outweigh the benefits. We always need to compare the risks and the benefits of a specific procedure. So if it's a surgery, it's quite risky, of course. Therefore, deep brain stimulation is not the best solution, not the first line of treatments for you if you have mild tremor, even if you have moderate tremor. If it's really debilitating, maybe then you can consider DBS. And of course, you need to discuss it with your doctor and discuss the risks of surgery, anesthesia, and so on. By the way, watch my previous videos on anesthesia. This is one treatment option, but basically there is no protocol of tremor management for people with CMT, unfortunately, and there are no studies, no papers that I could find discussing management of tremor in people with CMT. Some papers just mention that tremor management is important in CMT because it could be a debilitating symptom. In fact, it could be even more debilitating for children with CMT. And tremor does decrease the quality of life quite significantly for people with CMT. Even though could be a debilitating symptom for many people with CMT, there is no management protocol for people with CMT. But as I mentioned, DBS is one option. The other option is medications. And again, I don't know how effective anti-tremor medications are for people with CMT because there are no studies on that. But apparently, sometimes doctors do prescribe such medications for people with CMT. And these include anticonvulsants, benzodiazepines, and non-selective beta blockers. So talk to your doctor, maybe you can try a medication and maybe you can find something that will help you. The next important point is to have a healthy lifestyle. So I know maybe people don't want to hear this anymore, but it is really important to have a healthy lifestyle, including for tremor in CMT. This includes getting enough sleep and not being too stressed. So these two are known factors of enhancement of tremor. Other factors are anxiety, hunger, caffeine, and I've noticed that all of these factors, the lack of sleep, hunger, anxiety, caffeine, they do lead to enhanced tremor. So if you manage to eliminate these factors, you are already on the path to reducing your tremor. Interestingly, alcohol was shown to be a somewhat effective treatment for tremor, for a specific type of tremor, essential tremor. And even though in CMT it doesn't seem like we have essential tremor, there are different types, let's not go into that, but some people with CMT reported that alcohol does help them reduce tremor. But actually this is the minority of people with CMT. So I don't know about you, I don't think alcohol helps me reduce my tremor, and definitely this is not an advice. You should not be drinking alcohol to reduce your tremor. You should not be drinking especially too much alcohol in any case, and especially if you have CMT. I'm going to make a separate video on alcohol and CMT. Now, the other option of tremor treatment is specially designed wristbands, gloves, or stabilization systems. And although people talk about that, I couldn't find that many examples. I did find one system, which I'm going to include here, and you can find the link to their website in the description below. It is a wrist-worn wearable, basically looks very much like my smartwatch. It recognizes the tremor pattern, which is specific to the individual who is wearing the device. Then it sends signals to the peripheral nerves, which send signal back to the central nervous system, and it tries to counteract the tremors. So what we are really trying to do is to make our peripheral nervous system send the right signals to the central nervous system, so that it is not confused and will not lead to tremor generation. This is how it's supposed to work. I have no idea if it works for people with CMT. It is supposed to work for people with Parkinson's disease. So unless there is a large study on people with CMT wearing this device with the control group and so on, we can't really say if it works or not. But maybe you would like to look into this anyway and check out, maybe it works for you. Speaking of Parkinson's disease, in fact, I was wondering, how did researchers come up with this idea of deep brain stimulation, which I mentioned before, for people with CMT? Because at that time, when these two studies were done, it wasn't even clear at all what is the mechanism of tremor in CMT. But I think they did it just because deep brain stimulation works for Parkinson's disease people. So they thought maybe, although these two diseases are very different, CMT and Parkinson's disease are very different, perhaps the tremor is caused by very similar mechanisms. So that's why they decided to try deep brain stimulation for people with CMT, and it kind of worked. So maybe this wristband, this watch, the wearable that I just mentioned, could work in people with CMT as well. Who knows? Finally, exercise is our to-go solution for everything with CMT, but exercise aimed at increasing strength, coordination, and balance are highly recommended for people with CMT, including for improvement of tremor. In fact, in the study that I mentioned before, the study in 17 people with CMT1A back in 2023, it was shown that those people with CMT who experience tremor have worse problems with balance as well. And the worse the tremor, the worse the balance. So if you do exercises which are aimed at improving balance, you might also improve your tremor, at least the leg tremor. As for the hands, it's also important to do different exercises. And I do have a set of videos for hand exercises. So far, they're only in Russian, but if you do want me to record more of videos of that kind in English, I can also do it. Just leave me a request in the description below. So that's it for today. I hope this video gave you some answers regarding tremor in CMT. At least I think I did gain some insights from all the reading that I've done. Although, as usual, many things are still unknown. It's pretty much normal in physiology, biology. What we know about the brain and the nervous system is quite limited. But anyway, I hope this video was useful. Please give me a thumbs up, subscribe to my channel, leave a comment below. What kind of factors influence your tremor? What makes it worse? What makes it better? Share your tips and tricks for managing tremor if you have CMT. And please share this video. September is CMT Awareness Month, so let's talk about our disease more and let's share all the information we can gather. Bye bye.